this on our YouTube channel.
Her channel, yeah.
My YouTube channel, because I want my YouTube channel, MindBodySpa, to be a gathering of healers who have their gifts, who want to give their gifts and make their gifts available. And I want to make them available on my YouTube channel.
Great. Great.
So,
Thank you. That's absolutely what I want to do, is to expose more people to this approach, because
yeah.
I don't know of anybody who does this.
Really?
And I talked
Wow.
to my friend, I'm sorry, I have to tell you this. My
She's
friend,
excited.
Veronica, is a PT assistant. And I said, why don't they teach you this in physical therapy? This is what physical therapy is all about.
Do you know that? Do you know that back in the 50s, this was what physical therapy was? It had nothing to do with all those machines that have you. You know, it was a guy with a table, and you were doing a movement. And it was weak, and he was finding where the problem was, and then the opposing muscle that was causing it, and voila, you were moving again. Then he'd give you some exercises to do to keep it strong and mobile, and some stretches. And that's all.
And let me guess, the pharmaceutical industry somehow buried all that.
This is not the way we wanted to do it, because we can't make money off of it.
Exactly.
Yeah.
So you are?
I'm Jon Wood. I'm a licensed massage therapist in Portland, Oregon, and I actually do what's called manual therapy. I practice that with all my patients. I work with people who have been injured on the job, injured in motor vehicle accidents. Any kind of accident that creates distress and pain in the body is most often soft tissue related. And the way I approach it with this is it is directly involved in getting those areas that are painful moving normally again, and that releases the pain and allows your range of motion to return to where it was. So my approach is based on is that almost everywhere where your pain is at, that's not the cause of the pain.
Right.
It's usually an opposing muscle that is creating that stress in that area. And usually a muscle that's overstretched will complain all the time. And if you think about your body and how we work in front of us a lot, what happens to us is these muscles start to get used to being tight, and they start locking down and being in that position. Well, guess where most of people's pain is at? They don't feel anything in here. It's in the opposing muscle right back here. So this is where a lot of people go, oh, I've got some problems here. And the people that have that, they get it addressed by getting in there and softening the tissue for a while, and they feel better for 2 to 3 hours. But the cause is still a problem, because this muscle has not been released to allow this muscle to get back and do what it's supposed to do. So we release the tension in this, get it more mobile, and all of a sudden the pain goes away there. I actually did that one time with a girl who had an awful lot of pain back here. She worked at a desk all the time, and she was just screaming like that. And I never even addressed anything here. It was 5 minutes, and I said, let me help you with this. I'm going to do some releases here. And as soon as I got the releases done here, did the stretch, she stood up and goes, you didn't even touch it, but the pain's not there anymore.
Right.
So that's because that's not where it was caused from the first place. What we did is we dealt with what caused it. So you have to keep it up, because guess what you're going to do?
Right, you're just going to go right back. Yeah, right. But what I'm just real quick, the thing I noticed is that you were touching your chest, and granted, I haven't been in a physical therapy, chiropractic sort of situation in a while, but I remember I've only ever had one who was honest, but like, this scar tissue you have here would really benefit from some treatment, but I'm not allowed to touch that part of your body. And but we worked it out, and there just was someone in the room, and I developed the kind of trust with him that it was all good, but it was so fucking obnoxious to realize, oh, how many problems do women have because no one's allowed to touch their boobs, even if it's like there's a lot of muscles here, for fuck's sake. So I feel angry about it.
I get
but
you.
But I'm guessing that you don't have that same hypersensitivity, or I mean, how do you handle that?
As long as my patient is good with the way I approach it, and it is all purely physically oriented towards that, if they're comfortable with me, I'm comfortable with them, because most of the problems, you're absolutely right. If women with larger breasts, can you imagine how much tension on these muscles
Mine
those
used
breasts
to be
are?
much bigger.
Okay, so this is my point, is these muscles get strained and stressed. If you don't deal with them, you're not going to be able, I don't care how much problems you have here, you can deal with that, but it's always going to come back, because here's the problem. And so I do work with a lot of people that way, but it's all medical, it's all oriented towards that. And that's why I never had a problem, as long as my patient is fine with me doing that. If they're at all uncomfortable, tell me.
Right.
Because the truth of the matter is all I want to do is make sure that it's moving the way it's supposed to, so that the pain is gone and you're moving the way you need to.
Absolutely. Yeah.
Right. This is honestly the way I had visualized I wanted to bring this out to the public, is to have somebody videotape me with someone who's willing to be the guinea pig. Let's kind of address a couple of the things that are going on for you while you're in this position. And again, you have some pain in the upper chest area through here.
Okay. Here.
Is there a reason that you know of as to why it's painful there? Is there anything that you do regularly that causes it to kind of be stressful?
Because of radiation, because I had radiation here.
Radiation
and so
therapy, and
so it's all
okay.
scar tissue and stuff all throughout here. And this here is a tumor that's probably about the size of
You mentioned that.
I don't know.
A golf ball, maybe?
A small lemon, but it's cut in half. So and so it has this big wound in the middle of it. Okay.
Now that tumor is something that is your doctor indicated shouldn't be touched?
Well, I have to change the dressing every other day, so it has to be touched.
Okay, well, I don't want to irritate the area. I'm not sure what kind of tumor it is at this point, whether it will respond to manual therapy manipulation, but it's worth a try, and you'll notice whether it exacerbates it in the next day or two, or whether it relieves it.
Okay.
That'll make all the difference. So let's go ahead and work in that area a little bit.
Here's that one.
Okay.
And it's that all that bunching up of scar tissue that causes the radiating pain down my arm, I think. And you're such a good teacher.
Yeah.
No matter what, this will be really, really great. It'll be great for me to be able to go back and learn from you.
Good. Well, I think one of the things I've found is there's a lot of simplicity to the body, even though if you look at some of those schematics, and it's like, wow, that's amazing how complicated the body is. It can be, but the truth of the matter is the muscles respond to a certain stimulus almost all the same way. And that is the trigger point myofascial release that I perform is all about releasing tension in the knot or the adhesion or the area that is locked down. That area is what's causing lack of range of motion in the tissues around it, and also oftentimes pain not only in the area that is locked down, but in the opposing muscle in a joint. Our bodies do not work in a vacuum. It's a closed environment. So wherever you have a contraction of a muscle, there has to be an equal opposite stretch somewhere else in your body to allow that contraction to happen. And so if you have limitation on one side of the joint where it can't stretch, and you try to do the contraction on the opposing muscle, you know what's going to happen? You're going to be in pain, because the contraction you did on the opposing muscle doesn't have an equal stretch on the other one, because it has an adhesion that doesn't allow it to do that. That's why we're going to work not only on this area, but also on some of the opposing muscles back here to find out what's limited. Because if you've got this, that's what's going on here with your tumor, and the scar tissue that's been formed from radiation, it's going to limit the ability for these muscles back here to do what they're supposed to do, because these aren't able to do what they're supposed to do. That's why I always say, no matter where your pain is at, check the opposing side of the joint. And whether you felt it there or not, when you palpate it and press into it, you're going to find adhesions that have been formed, and those need to be released just as much as the ones where the pain is at. Okay. All right. So just to begin with, let's go ahead and address some of the areas in through here. Now, you say the tumor. Let me see where we're at here.
So I'm good at addressing
Right
on it. But
underneath the
it's
axilla.
right in the crease of
Okay.
the axilla, and
Okay.
there's a tumor bundle above it and a tumor bundle below it. So the wound is actually within the tumor,
Oh,
which
wow.
is why they say that the wound will never heal, because tumors don't heal.
I get that.
Ain't part of their deal. So
So what we are going to try to do then is to ease, and this will have to be done pretty regularly, because if the area of the reason for the lack of movement can't heal, then you can assuage and release the tension in the tissues around it, but it's going to go back because it's still dependent upon that area that's not healing. And so we'll have to do this kind of regularly, but it's going to help continue to keep this area nice and mobile so that you can do more movement than you did before without pain. It's just probably not going to be pain-free.
Yeah.
But we can handle an awful lot of pain in our bodies. You've already shown that. So what we're going to do now is we're going to find these areas here, and we're going to see if we can get them moving again. So the pectorals right in this area here, and again, let me know if any of what I'm doing here is uncomfortable for you, and if need be, you can go ahead and put your hand along the breast so that I'm not next to it. But whatever.
There's no breast.
Yeah. So, but there's tissue there, and like I said, whatever you would feel. So there's a lot of tension right in here. So what we're going to do is we're going to try to get the pectorals. I want you to notice this last figure over there where the pectorals are attached. Right there, they're all attached towards the shoulder and then along the sternum and down into the rib area, okay? So there is a movement pattern in all of those fibers that directly addresses complete contraction of that area according to how you move across it. And let me explain. This area right here, tell me if there's any
right there.
Right there. So what I want you to do is use this part of your shoulder as a fulcrum. This point on the shoulder is the start point of all the movement of your arm. So you're going to go towards where I'm pressing. So as I press on it, you're going to reach across. Here's the point there. It makes the line that goes, I'll bet, right towards the coat rack. So what I want you to do is to push your arm towards the coat rack. There it is, right there. Feel how that increased that?
You know where I feel it is down here.
Okay, so that means that this is in the way of you being able to do that movement. So here's what we're going to do. Go ahead and relax. That did increase the sharpness, right? A little bit? A little bit, okay.
A little bit. Mostly I started feeling it down here.
So now what we're going to do is we're going to address what caused you not to be able to feel that contraction. Tell me when I found that spot that was painful for you when you reached, okay? In fact, point it to me.
It's like
right in there? Okay, so here's what we're going to do. Tell me when it feels like this. Right there?
Just back a little there.
Right in there. Okay, so now this is your tricep. Let's contract the tricep and release the tension in here. Yes, exactly. Right there.
Like that.
And that increases sharpness. Okay, 3, 4. Now relax it. 2, 3, 4. Now press again. 2, 3, 4. And then relax. You can just keep it right there. Keep it relaxed. 3, 4. Do that again. Okay, it's moving better already. Do you notice less sharpness?
I notice.
Okay, excellent. And relax. Now we're going to do it one more time, and then we're going to stretch it. Go ahead. Push it. There we go. That feels like it's moving better, okay? Now let's try to stretch it, and then we're going to go back to doing that movement, and you're going to notice that this won't bother you anymore, okay? So now let's stretch it. The stretch goes for your tricep, goes like this, right behind you. Okay, so you're going to bring it back like that. Ooh, not too much, yeah. Just you notice the stretch though in it, right? Okay. There we go. And your, excuse me, could you hand me that bottle? Right
I brought my
now
bottle.
to in front of you. That cream right there.
Is that the
Thank you.
DMSO stuff?
This is the Oregon
We are
cream.
total in love.
We want to buy a case of it.
A case of it. Well, I'm in the process of, we are actually starting to get some more people involved with it, and I'm excited to tell you that that may be coming very soon, that we'll have that available for everybody.
Cool.
And so, okay, so does that feel like it's a little bit less tight in there?
I think so.
Okay, come back down, come back down. Now,
But see, it hurts other places when I stretch up there.
yeah, see, so, and like I said, it's not a closed system. So wherever you do some stress this way, it's going to cause pain elsewhere. But that's why we take this a little at a time, okay? Especially with what's going on for you, we want to address all the things that are causing this. So now I want you to go ahead and tell me, there we go. That feel better there?
I don't feel it at all.
You don't feel it at all. Okay, now I want you to do this work again. My point being is that now that we've dealt with the stress of this muscle, let's go ahead and push right in there.
Right there.
Okay, now what I want you to do is I want you to reach across towards that. There we go, and across a little bit further. Do you feel that increase a little bit there?
I feel it increase here.
Right in
but
there.
I don't feel it
Don't
here
feel
at
it there?
all.
Of course you don't. That's because we took care of it.
It's amazing. I can
it's-
throw down my crutches and walk.
Praise the Lord.
Praise the Lord.
This is awesome. Thank you so much for doing this. Like I said, this is so much fun.
Yeah.
This is such an amazing therapy. I'm really blessed to be able
It
to
is
show.
fun. It's amazing. It's an amazing therapy. And I just, it pisses me off that I've been to chiropractors and physical therapists that know absolutely nothing about this shit.
I know.
And Jeanette's way more knowledgeable and experienced than, probably the majority of humans, even those who are professionals. So like when she says she's surprised about this or disappointed to not seen it, like she's really had way more than, most.
I have to echo that because, in my business, I work with 80% of my work is doctor referred. And the first thing that they do is they refer to their physical therapists. Now, I'm not at all down on physical therapy. I just think it's misdiagnosed and referred as to when physical therapy can be more effective. And I feel that this kind of work, if it were referred here first, then the muscles start getting moving again. The physical therapist is going to be a rock star in getting it going the way it's supposed to. And that's really simple. And if I could get doctors to understand that that's the key to this whole thing, rather than going through
them the tape.
there we
There'll
go.
be more than one episode of Jon.
All right, so let's now that increase that. Let's go back to it. So remember, the approach is you go into it and you hold it for about 4 seconds and then relax it completely and then do it again. It's a little muscle confusion to get that to release. Exactly. Go. Here we go. And try to bring the arm down into your chest, right? Okay. Feel wherever it increases that sharpness, that's the correct move.
3, 4.
And then relax it. And you can just drop it right down there.
Okay.
Just make sure that you relax this the best you can. Let your shoulder drop a little bit. There we go. Good. 3, 4. Do it again. Push into it. Awesome. I can feel it moving now a little bit. 3, 4. Then relax. It's already starting to move better. 3, 4. One more time. How's that sharpness? It's probably gone down quite a little bit.
It's quite a bit.
It's
I still am limited in my emotion, but
this is a process, and that's why what we're doing here will begin a process of unwinding your body to its normal movement. This is the time I
stretch, right?
There we go. And that's now that it's feeling better there. Good. Now, when you stretch it, let's go ahead and relax for a second. Second step.
Gotta be
Oregon cream.
Oh yeah.
We got to put the cream on because what that does is it creates blood flow into that area bringing in nutrients, taking away waste products at hyper speed, allowing this to heal more quickly. Okay. And because it has, and there's the ingredients list, it has some of the most amazing healing herbs in it. It doesn't borrow from Peter to pay Paul in your body. It actually has all the basic ingredients that are necessary to heal that tissue in the formula itself. So your body doesn't have to go looking for something that's not there. It's all there. So there we go. Now,
so now I want to stretch it.
Yes. So what you want to do is get yourself kind of in the position that you were in, and now you pin it right there. There we go. Now come the opposite way and feel the stretch. Did you feel it there?
Yeah.
Okay. Now come back again for a second. What I want you to do is pin that. Let it slide a little bit, but kind of hold it to allow that stretch to just pull those fibers a little bit further apart.
Okay.
So slowly come this way. The right movement. There we go. Oh, there we go. I can feel it. There we go. 3, 4. Now wait for it to become less tight. You'll notice that tissue starts to release, right?
Right.
Okay. And now we know that tissue now is more comfortable being able to do that movement without restricting you because it's afraid.
Look, I mean, it's
and
practically
you can go back
going,
further.
it goes all the way back, and it doesn't hurt here at all.
At all.
Wow.
And so, and remember though, the key to this whole thing, this is why I'm teaching you, is that when we get these muscles to release, what's going to happen is if you ignore them, don't pay any attention to them until you come back and see me in a week or two, they're going to want to go right back to where they were safe and comfortable before we release them. And so that's why if you can address this, address it on a daily, every day, but you'll notice that the areas release more quickly as it gets comfortable with this movement pattern. And after a while, you're going to find it difficult to find any spots that are painful.
What? Yay! We can be as smart as orangutan.
Yeah, okay. That's a good story, what you just referred to, but yeah.
That may be stretching it a little bit,
No,
but
you don't know about the orangutan story. Just trust us. It's
no, that's my point. It may be stretching us to be a little bit more intelligent than orangutans, but so be it. All right, so I put some more cream on that. Now let's go to another spot. And remember what I told you about the fulcrum on the shoulder. Let's go down this area right in here. Is that sharp right through there? It's very tight.
Yeah,
it's scar
right
tissue, I can tell. As I press on it, tell me if it starts to wake up a little bit. Feels like it's starting to become a little bit more intense, a little sharper. Not really? A little bit, okay.
Mm-hmm.
That shows just how scarred that tissue is. When I can press on it and it doesn't respond with pain until way after I've been pressing, those pain receptors have been messed with. Now it's feeling a little bit sharper. Okay, now we're going to pin it, and you're going to, from here to here, I'll bet if you push the heel of your hand towards the doorknob on the door, there it is, right there.
God.
2, 3, 4, and then relax it. Drop. Very good. 2, 3, 4, and again, push the same amount each time. 2, 3, 4.
I can already push further.
I know you can, but don't right now. Okay. The reason I'm saying that is I want your body to feel the difference, to actually feel the improvement, because if you keep pushing, you're going to keep going into the pain, and it's not really going to manifest that, wow, it did release it. So do the same thing again. Right there. Yep, it is moving a little bit better there. A little bit less painful when you do that.
Yeah, now I have no pain right there.
Okay. Honestly,
move it further.
and then when you have no pain, go ahead and move it further. There we go. Increase it a little bit. Did that increase the pain a little bit? Okay. That just means the deeper fibers involved in that range of motion need to be released now too. We've got the other ones released, but now we're releasing these. Go ahead and relax it down. Drop it right there.
We're not trying to hurt you, baby.
No, exactly. In fact, give it love. Tell it, you know it can do it. There we go. Push. Now bring your arm down into that and try to make that pop.
Oh man, that is really sore.
And then
I
relax.
don't know how you moved your fingers.
Yeah, I did. I moved it ever so slightly. You've got so much scar tissue around that area. Just a slight movement creates new tension on new fibers. But that's okay. That's why we're doing this, because after a while, you won't have to do that nearly as much. Go ahead and do that again. Press. Okay, good. Yep, I'm feeling it moving a little bit better. How's the sharpness?
Yeah, it's less
It's
sharp,
a lot
but I
less
think
sharp.
you moved your finger.
I actually kept it there at the
You
same
really
spot.
did?
That's why it's less sharp. I didn't move to a new spot. Now we're getting the tissue that I'm on starting to become more mobile. The reason it's less painful is now it can push, it can move underneath this pressure. I'll find a spot in your body at some point where I can press so deep you think it's going to hurt something, but it isn't painful. It's because all the tissue around it is moving so good that it's moving right out of the way as I'm pushing into it, and there's no resistance whatsoever.
Oh,
But
you
when
just
you
hit a big globule of fat.
well, that may be part of it too, but even then you'll probably feel it. But my point being is that this area here, the key to it is now it's starting to move again, and it's starting to become more mobile. Why does it scream at you less? Because it doesn't hurt as much, because it can move out of the way more.
I see.
All right, so now we've got that released a little bit with that, and that was really quick, honestly. Jeanette, this is really exciting. As quickly as this released, you only had to do a couple, 3 before it started feeling better. That's really an indicator that the tissue wants to start moving again. All right, so now that we've done that, we put a little bit of cream on that, right? Step 2, okay, released it. Now we step 2. Now you take your hand, you find that spot, pin it, and remember you went this way, so what are you gonna do? Exactly 180-degree opposite movement, and there you have your stretch right in there. 2, and you hold it. Don't make the stretch be too uncomfortable. Hold it until it starts to become softer, and you can feel it slide a little bit between your fingers. You're going to notice that your shoulder will go back further because now the tissues are no longer restricting that movement. You still have a lot to go here, because I can tell there's a lot of scar tissue down in this area, and this is why I addressed it, because I feel like you could have better shoulder range of motion if we deal with a lot of this tissue right down in here. Okay?
This is why I don't dance anymore.
Well, we're going to stop that and get you back. And then
She's a Contact Improv fan too.
Oh.
Have you gone more than once? Or?
No, I haven't. No. They closed down.
Oh, that's right.
the month,
Right.
and so they're coming back in June. Good. All right. So there we go. All right. Now there are other spots. Remember when I slightly moved my finger? So now we want to get some of those other spots right in there. Ooh, that's a good one right in there. Okay. I apologize for getting a bit. Again, you always let me know if it's a little bit too much. I usually tell by the grimace on your face, but right there feels like I'm right on a spot. Does that feel like it for you too? Okay, from the point in your shoulder to there, it's again towards the door. Go ahead and bring it down right in there, right in there. Excellent. 2, 3, 4, then relax it. Just drop it. Make sure your shoulder drops too. Let it drop. Let that shoulder right there we go. All right, now again, push. Good. I can feel the muscles start to move a little bit. 3, 4, drop it, relax it. There you did it with your shoulder. That's what I wanted. 3, 4, and then again. 2, 3, 4, and relax. Okay, it's starting to move better. It's a little bit less sharp in there.
Yeah, but you moved your finger.
It actually, it's slid along that area there. So go ahead and do that again. Oh yeah, it's moving better there. 3, 4, then relax. 2, 3, 4. Do it one more time. Tell me. Oh, there it was good. I felt the muscle contract all the way through. Less pain, right?
No pain.
No pain. That's awesome. Okay, now that it's ready, we put some cream on that.
So we just keep poking at the same area for how long? God.
So here's the thing. This is how fascinating and intelligent the body is. You have a whole bunch of stuff in there that's wrong, okay? The areas that are most painful are the ones the body wants you to deal with first, okay? Then as those get better, guess what your body's going to uncover for you? More. And then those will be the ones you deal with. And now keep this in mind. There will be an end to it because you have a closed system. It's not like it goes on forever. You will find that relief at some point when you're looking for it and you go, you used to be rife with all this pain and I don't find it anymore. And that's when you know you're getting back to where you need to be.
Now.
Okay, now
Here I'm pinning it,
and you're
and
coming
I
out
went
with it.
like this
So,
on
there we
the
go.
top.
There we go. Exactly. And just hold it until this area starts to release. Now, remember, you don't have to do it.
Hold it anymore.
You don't have to do it that hard. Okay.
Okay.
Keep in mind that what we're doing here is a process, and you can induce the body rather than beat the body into that. And it's so important that you manifest that because, like you said, this area, you love this area. It loves you. It feels like it's been abandoned because you haven't done anything with it. You didn't know what to do with it. Now that you can pay attention to it, it's going to respond as just like a baby to a mother.
What if you do your chakra balancing right after your exercises? What would that do, I wonder?
There you go. And that's, again, this is what this is all about. In fact, a lot of the trigger points that you find in your body are along the meridians or the sin lines, as in Thai massage, where all the energy of normal energy movement is. And it gets obstructed by those adhesions, and all of a sudden it gets stopped. And the more you can release those adhesions, the more the chi, the more the energy will flow more freely without restriction. So, okay. Now, what we did was we released some of the stuff in through here, but also because this is a closed system and what you have are another set of muscles that had to move because you moved these. Let's find out if there's anything back here a little bit dysfunctional right in there. And so what this does.
You find it so easy. Am I going to be able to find it when I'm on my own?
Okay, so you're going to have, first of all, you're going to have the video, which will be helpful. But here's the thing. When it comes to this work, a lot of people pick and poke at that area to try to find it, okay?
Right.
I don't let that get away because when you pick and poke, if it's just moving a little bit, it will slide out of the way. You go, well, that's not it, but it's right there. So what I do is I move into it, close to it, and if I don't feel like that's where the sharpness is, I keep the pressure deep and I slide. And as I slide, guess what I found? Right there. And that's all you need to do is to slide into it. You're not injuring anything when you go deep because it's not hurting you, right? Until you get to the point where they can't move out of the way, then all of a sudden it says, stop right there. I'm not going anywhere. Now you found the spot you need to release. And that when we do that, now we know where it's at. It's right there. It's along that same line that you're pushing your arm. It's probably closer to the coat rack there. So now that I pinned it, go across it, move it until you find that movement that hurts the most. Is that it right there? Are you sure of it? There, right? There it is, right there. 2, 3, 4. Now relax it. Drop it down. 2, 3, 4. Do it again. Make that pop. Good. 3, 4, and relax. And one of the things most people need to understand is if you're doing this right, when you do the movement, it's going to hurt more because those are the movements those fibers are involved with. If you do a movement and there's no increase in sharpness, that movement isn't involved with those fibers. So find the movement that makes them scream. that's when you know you're on the right side.
Neighbor screen.
This is as I tell my patients that this requires a masochist and a sadist. You're the masochist, I'm the sadist.
Or if I'm doing it myself, I'm the
you're both of it.
and the
You're
sadist.
both. Exactly. So, all right. So now do it again. See if it's gotten somewhere. Oh yeah, it's moving better already.
Yes.
There we go. Excellent. I mean, one of the things that I noticed from the first time is how quickly your body responds to this work. That indicates the body is so ready to be healthy again.
Yeah.
And that's what's so exciting about seeing the releases happen so quickly, is you just need to learn how to do it and do it regularly. And you're already, like I said, from the very start, you had an
Okay, now I'm
intuitive
going to go back
understanding.
over.
Okay, so now remember, stop for a second, put the cream on.
Oh yeah, put the cream on.
Okay.
So after you do an area for a bit, then you put the cream on.
Put the cream on
before you
and-
move on to another area. Is that
Before
right?
we
Before you
stretch it.
stretch it.
Before you
Because
stretch.
because it's bringing
This-
water in there. As you stretch the fibers, they open up and the water can sink in and create a real flexible fiber. If the fibers aren't open, the water stays around it and it can't stretch because there's no liquid to allow it to stretch. Yeah.
Just knowing Jeanette, and you've already seen it happen a little bit, what I'm hoping you'll do is kind of really help her identify when is she pushing a little too hard, you
Okay.
know, because that's a hard thing for a lot of folks, but definitely teaching her how to tell.
So here's the way to tell more than anything is the next day you're going to be sore as sin. And that indicates you probably went too far. The soreness will go away. When it is sore like that, I suggest you put the cream on regularly and do some simple stretching of that area, okay? Because what's happening is if it's really sore, it's trying to spasm in that because it's freaked out. It's moved from a new position into something it's not familiar with right now. It was a long time ago, but it doesn't have that memory. Now, as we relate it to what it's supposed to do, it starts to get, oh, okay. It becomes less sore. It becomes more mobile. As you do this work, after the initial soreness, you're going to try to get really deep in there and do it really hard, and it's not going to be nearly as sore. And that's indicating that the tissues now are really moving. The soreness is not manifesting because the muscle knows what it's supposed to do, and it's doing it well, and it doesn't have to complain to you.
I'm guessing too, though, that if somebody's not drinking plenty of water and flushing out everything that's getting opened up here, that could also lead to maybe some pain the next day.
Yeah, it's hugely important. Here's what's interesting is it's important that you drink plenty of water, if you hydrate well. But one of the things that's even more important is these areas of adhesions, they can have water all around them and still not be flexible because they're so tight. They've closed the cellular structures down, and it's a closed system in and of itself, and none of the fibers are open enough to allow water to come in. So what we do is this work. Once we start to do this pressure and movement, the cells open up because they have to be able to be flexible. If they're locked down like this, they can close down and not do a darn thing. Once they start moving, they've got to be flexible. They have to open up, and that's when water can sink into that area and create movement.
It's just like life.
It is so much like life.
We love finding
These little areas here are like those times when we don't want to change.
We have to open up. We have to become vulnerable in order for unity to happen.
I'm glad you're
Amen.
saying that so you can hear yourself say it again later, because it's all real important too.
Okay, so, and again, there are other areas on the back side of this shoulder that need to be addressed.
Yeah.
And it'd be easier for us to do so if you're on your stomach. And then we'll go ahead and put this up for you. Okay, let me get that out of the way. There you go. Get your face comfortable in the cradle there. And we'll put this underneath your ankles. Take a little pressure off your back.
So, remember I had sciatic pain?
Yes.
Well, the sciatic pain completely went away. But now I have hip
Yes.
pain on both sides.
Okay. And again, that's easily, worked out because basically, again, it's all about the soft tissue in those areas not moving the way they're supposed to. That's why you hurt there. So this is a simple approach. We find the spots that are not moving. We get in there, we put some pressure. Tell me when it feels right in there. Okay. So this is part of that hip rotation muscle set. And so what you're going to do here is, as I press on it, we're going to try to do some movements to release this. Okay, now there we go. You understand that? Now turn the hip out. So no, the other way. There we go. Now swing your leg out. Voila, that's it right there. I could feel the difference. And then back. Do the same movement back as you did going into it. There we go. Now, not quite so dramatic, okay? I want you to lift up. Well, you can be dramatic in your
vocalization and stuff.
But right now, I want you to lift up for me. There it is. Now swing it out a little bit. There we go. And turn it. Keep your leg up. Keep that leg up. There we go. 3, 4, and now back and down.
It's going to be some good workout.
This is as big a workout for most people as physical therapy.
Mm-hmm.
But what it does is it actually helps things move better and not cause more pain at this point. All right, so.
We're so excited.
Yeah.
Out, and out, and up,
And then down. Well, it looks like you're doing a little bit more freedom there. Okay. Let me know if it's less sharp. Okay. I think it is.
That's where some of my worst trigger points are too, and dang, those things hurt. So will she use the Theracane to get into these sort of spots?
Yeah.
Okay. She's actually not going to do it from this position. She should probably be on her back and with the floor there. Now, here's the one thing that I want people to understand when it comes to this. Yes, we're able to do all these movements here, but the truth of the matter is you don't need to do the movement to get this to release. You just need to activate or contract the muscle. Now, watch what happens here when I have her try to do those movements against resistance, as if she were on the ground and trying to push her heel into the ground. She's still going to make that muscle engage. Now, hold it just a second. Now, push up into me. See how that engaged? Okay. Now, turn your hip out. Now, try to bring it out. Bring it out. There we go. Bring that whole leg out. There we go. Good.
Whoa. Look at that flexibility.
And now come back. There we go. How's this feeling in here?
It's gone.
It's gone.
It's gone.
Well, usually it doesn't go completely away, but it's on its way.
And my guess is her pain tolerance is extraordinary.
Yeah, I got that. I got that too. And that's why I know that, like I said, I want people to understand that this is a process. After the first round, basically, you should have less pain, but you're still going to have quite a bit of restriction. The next day, you're going to address it, or the next day after that, depending on how sore it is, you're going to do it again. You're going to notice that, oh, I got a little bit more this time. And then before you know it, you have full range of motion, no pain in here, and you're able to move twist your hips like you did when you were younger. So that's the key to this whole thing, is getting you to move again.
Like we did last summer.
So what we need to do is we need to make sure that these muscles that allow her to do the walking without any restrictions are as released as possible. So that's what I'll address, I think, today, since this seems to be, at least at this point, more important. But what we got back through here, I still want to do some of this work here, because this opposing set of muscles has been affected by the fact that you can't move these muscles in front. And so we'll find a few spots that are like that right in there. And what this does is it helps you reach behind you, whereas the muscle here helps you reach in front of you. So let's see if you can reach behind you. Lift up, there we go, and then across your body. There we go. 3, 4, and then back down. Was I on a spot that is very sharp? Did it increase the sharpness? We know that's the right movement then, okay? Go ahead, I'll keep pressure on it. Good. And try to reach across your body. Right into it. Good. 3, 4, and then relax. Good. 3, 4. Now do that again. Tell me when there's almost no sharpness or it feels much better than it did.
Almost no sharpness.
Almost no sharpness. Okay, good. Now relax. What do I do next?
And then we do one more time, and then we go the opposite way.
No. Stop for a second here. Let's do it one more time.
Oh, yeah.
Okay, cream. There we go. All right, let's do it one more time. Go ahead and do that. Lift up and across. Excellent. 2, 3, 4, and then relax. Awesome. Okay, now we'll put some cream on it. There we go.
I scream, you scream, we all scream.
That's great. All right, now, interestingly enough, your stretch, you can actually do it from this position, okay? But what we're going to do is I'm going to pin a little bit to allow you to feel that stretch a little bit more readily. So I'm going to pin it. And so what I want you to do is I want you to reach above your head slightly. So you're going to reach above. There we go. Now straighten your arm out. There we go. And now reach. There we go. You feel the stretch there?
Oh, I feel the stretch everywhere.
Everywhere.
But not necessarily there.
There. Okay. So that's why we know now that there are spots that we need to release.
There are hundreds of them. And
Yes.
they're just all
There are a number.
up and down my arm.
Well, and that's why I think, like I said, the more that you understand how to do this, the more you can spend the time taking care of that. And that's really key. You are going to be your own best therapist. There's no question that nobody can heal you better than you. But you need to know the techniques, why the body does the way it does. And the more you understand your body, the more you can entice it, induce it to do what you want it to do, rather than beating it up and to a pulp before it does anything. And even then, it's going to want to scream back at you by tightening up because you beat it up so much. And that's why this work, you can do really intense work with this, or you can do semi-intense work to get it moving better, but not beat it up to a point where it creates more adhesions because it's been injured by doing that. That's why this work is all about you finding your own limit, your own level of movement to be able to get better. Everybody out there has got to do the same thing. That's why when you overdo it and you're super sore the next day, you know, okay, well, I don't have to go quite so hard on that. It may take a little longer, but it'll be much easier for me to be able to do it with less pain and less soreness afterwards.
Okay. You have to do this hip because.
So I'm going to actually, I haven't even gotten to putting the cream on this hip. I'm going to do that first. And this is only half of the hip, so I'm not going to abandon this until I do the other part of this hip. Now, think about this. You've got this muscle here that lifts your leg up and turns your hip out and swings it this way, okay? Now, I want you to back it down. Nope, put it back down. Now, on the other side of your body, you have a muscle that actually brings your leg down in front of you and turns it in. There we go. And now wait for a second. I'm going to find it and we're going to release it. Okay. All right. So go ahead and relax.
It's this one.
Well, I know, but that's not the one we're going to deal with yet.
Okay.
Because that's not going to even be involved in what we're doing here. Tell me when I find the sharp spot right in front of your femur here. Okay.
Okay, I guess
A little
that's
bit
kind of sharp.
A little bit right there. Feels to me like, okay, now what I'm going to do is pin it, and your movement is going to be the opposite of what we did back here because it's the opposite muscle. You're going to, what I want you to do is bend, no, I want you to bend your left leg so your foot's up in the air. Okay, good. Now the foot's out of the way. Now I want you to turn your knee in and press straight down into the table with your thigh. There we go. 3, 4, and then back. Okay. Now, I want to make sure I'm still on it. Does that feel like I'm right there?
Yes.
Okay. Go ahead and do that again. Turn it in. There it is, right there. Press down.
Oh my God.
There we go. 3, 4, and then back. Takes you out of that pain syndrome. And now we go back into it and tell me again. Go ahead, turn, and press down harder. Press harder. There we go. There we go. 3, 4, then relax. You know, sometimes when I ask you to do that, you don't have to if it's so too painful. I just want you to make sure that you're doing it. Okay. All right. Go ahead. And yeah, there we go.
Either you fill up the spot,
No,
or else I don't have it anymore.
no, it's the spot, and now there's a lot less sharpness in there. Now go ahead back to neutral. Good. And one more time, just to make sure we're on the right track. Oh wow! Look at how much further you are able to turn your leg in and press down, and now relax. Good. Now, the stretch for this is a little bit different. We're going to have to get you off the table to do the stretch, but that's what I'm going to show you here shortly. Now, I'm just going to put some cream on that area. And to a certain degree, I can actually stretch it this way. So what I'm going to do, we're going to stretch this a little bit by bringing you out this way. I want you to roll your body to your right. There we go. There we go. Feel a bit of a stretch in here? A little bit, yeah. You've got pretty flexible, strangely enough. And then relax it. Well, I think it's mostly your ligaments are a little bit loose, but I'm not absolutely sure, okay? We'll find that out a little bit more. Now, we're going to stretch the front part here, excuse me, the front part here by going the other way. Oh, yeah. Now, roll your body this way, towards me. There we go, right there. Feel the stretch in here? A little bit, okay. 3, 4. I can feel that stretching it. And relax. Okay, that's where we're going next, okay? We've got a little bit of movement now in both lateral and medial rotation of your hip here. So let's see if we can do the same thing on the other side. Okay. So you said that you had a little bit of pain right kind of in the middle, but right near your sacrum here? Anything going on?
Well, yeah, right there.
Right there, okay. All right, so let me get the Theracane out. I'm going to put some pressure on that. Tell me when it feels like I'm right.
You're on it.
All right, on it. Okay. So now what we're going to do, you know what the movements are. You have to extend your leg behind you. There we go. Turn your hip out. Ooh. Now.
Oh.
And back. Okay. Now, if you want less pressure, I can put less pressure on, or you can be fine with this because it's going to get better. You know it will. So go ahead. There we go. Now notice when you swung it out. Did it increase the sharpness when you swung it out, not when you turned it out?
Yeah.
Did it increase the sharpness?
A little bit.
Okay, not a lot though, because these fibers aren't hugely involved in swinging your leg out. The ones by the hips are. Okay, so I want you to remember that if it doesn't hurt when you do a movement, you don't have to do that movement.
Oh, okay.
Okay, so now just lift it up and turn it out.
Oh,
There it is, right there. 3, 4. Now turn it in and down. Okay. All right. Okay, and again.
Ouch. Okay.
Just take some, Jeanette, take some nice deep breaths. Go ahead and relax for a second. Take some nice deep breaths. This is taking a lot out of you. And what I want you to understand is that you have to listen to your body. If it's taking a lot out of you, stop. Rest a little bit. Give your body a chance to recover a little bit so that you can address this with your full body awareness of it, rather than being so tired that sometimes you can actually do something you don't need to do when you're tired and not aware. Okay? So now you've had a chance to rest a little bit, lift up, turn it out. Excellent. 2, 3, 4, back in and down. 3, 4, now. Again, when you're ready, lift up again. Engage it, turn it out. 2, 3, 4, back and down. 3, 4, and again, up. Feeling it moving better now. 3, 4, back in and down. How's that pain level? Starting to come down? Starting to feel the movement. Okay? And then you do that again. You lift up, turn it, good. There's definitely more movement in there. Back in and down.
Cream.
All right. You absolutely. You call for it. Your wish is my command. There
Oh,
we go.
poor little baby.
Yeah, and it's
You really
but
are hurting you.
yeah, but it's going to love you for it because it just hasn't been doing what it was meant to do, and now that it starts doing it, you're gonna love it. And
Just like my father used to say, this is hurting me more than it's hurting you.
Okay, so let's find a few more spots, and before we do the stretch, again, remember this is a 3-step process. I already put we did one, and then I put the cream on. How about in here?
Yeah, right in there.
Right in there, okay. Feel like I'm right on it there?
Yeah.
I thought so.
Lift my leg up now.
Yep, lift it up, turn it and turn it out. There we go. Maybe swing it a little bit. Did that increase it some?
A little bit.
Okay, then back and down. Maybe a little bit of swinging, but I want you to lift it straight up until you feel it engage and increase that sharpness.
That's mostly where I feel it is just
Right in here?
straight
Okay.
up.
Now turn. There we go. 3, 4, and then back and down. Good job. This is where, let's go ahead and get this released a little bit more. Again, take your time with this. If you need to do 6 or 7 seconds in between, that's just fine.
Okay,
Okay?
here we go.
And again. It's moving better. 4, and then back and down. Good. 2, 3, 4. One more time. There we go. Turn it. There we go. And then back in and down. Good. How's that feeling?
Cream.
It sounds like it's feeling better. She's calling for the cream.
Creamy.
Cream.
I'm screaming for cream.
Cream for cream. All right, that's great. Now, and I'm ultimately what I'm going to do is I'm going to show you how to stretch these. But you're also going to be doing this work yourself in the same position. You'll be able to stretch. It's just easier for me to do it with you while you're laying on your stomach, but it will be easier for you to lay it while you're on the floor, on your back. With a little bit of a yoga mat or a little bit of cushioning so it's not super hard, and then use the floor as a fulcrum for the therapy. All right?
Yeah.
So let's go ahead, one more area down through here and see if we can find something. We did. Right in. Right there? Okay. Is that too much pressure? It's okay.
It's like,
You're crazy though. I know.
Does this hurt worse? Does this hurt worse? Does this hurt worse?
I know.
Okay.
A lot of my patients call me Dr. Pain,
Oh my God.
but they do it with a smile, and that's what pleases me. I'm glad. 3, 4, and now do that again. Up and turn it out. There we go. Nice. Okay, I'm feeling it start to engage better. And relax. 2, 3, 4. And then again, up. Good. Turn it out. There we go. Better. 4 and down. 2, 3, 4. And again, one more time. And turn it out. Good. And then back in and down. Good job. Okay. Now, Better, right?
Yeah.
Less sharp?
Yeah.
Excellent. We'll call that good. What do you say?
Great.
There we go. All right. Okay. Now, I want to I want you to turn over for me. Okay. First, before you turn over, we're going to do. Actually, that will work. Let's just have you turn over onto your back, and I'm going to show you how to do some of this work while you're on your back. Okay. Get this out of the way.
I want to scoot down.
And scoot down, yeah, so your head's on the table and away from this here. Good. Now, lift your knees up for me.
Okay.
And we'll call that good right there.
Oh,
All right.
I'm in so much pain right now. I just really want some Tylenol and.
So here's the thing, Jeanette. I really believe that you are somewhat
Believe me?
somewhat all or nothing with your approach. Okay.
Okay.
One of the reasons why some of these areas may still be pretty darn sore tomorrow is because you worked them too hard. Okay. I know your pain levels are really up there, which means you don't have to incur a lot of pain to be able to make some movement happen in there. Okay. So you're actually doing one of the stretches that I will show you, similar to it. Right. Okay.
He needs to stretch out.
So let's stretch it out a little bit more specifically. Okay.
All right.
Right there. Okay. Now, from this side that we just worked, we're going to bring your foot up. You're going to put it right on your kneecap, right there. Put actually the arch right on there.
Put the arch on there.
There we go. Now, you bring your hand here and you're going to come this way. There we go. Now you feel the stretch in this area through here, right? Okay. So tell me, as you're doing that,
It doesn't hurt.
It doesn't hurt. Now bring it up a little higher. Okay. And it shouldn't hurt with stretch. It should just feel like the tension is releasing. Now, is there any area here that feels like it's just not letting go?
Yeah, but it's further down.
Okay.
From where we were working.
Okay.
Before.
So we didn't get to that, but now we can address it because your stretch exposed where it can't
where I
move.
need to work.
Yes,
out.
exactly. So let's go ahead. Tell me if this hit right in through here. Or right up
I
in.
don't know, maybe it doesn't hurt anymore. I think I was just kidding.
I think it's right up in
Yeah,
here.
it's right in there.
Yep, there it is, right in there. All right, so now what you can do is you're going to take your Theracane and you're going to go ahead and let go with your hand there, but keep your knee right there. Now you're going to do that. I suggest that you do this next to a wall to use that as a fulcrum, okay? So imagine my hand as a wall, and now you just doing that will increase the sharpness in there.
Oh, yeah.
Okay, now that you're in that position, move towards it.
Yeah. Yeah, I like that.
And then back,
That is easy.
and then do it again.
Too bad I can't do that with my arm.
Well, that's why you have to have like a fulcrum, because otherwise you're pulling way too hard and it's not good for the rest of your body.
Yeah.
There we go, right into
Oh
there.
my gosh.
There it is, right there.
Baby. Oh.
And then relax. And let's do that one or two more times before we go back to the stretch. Always go back to the stretch after doing this work within your stretch protocol. There we go. That's better. Now, put some cream on that.
I'm never going to let you get away with not putting cream on me.
Good. That's what I want to hear. All right, good. Now, go ahead and do your stretch again.
Switches.
Yep, that way you did it. Now, notice,
But this way, this way,
Or-
this way.
whatever exposed that area, do it. There we go.
Yeah.
You don't feel it
I
there.
don't feel it
Yeah, it's
anymore.
because we just got rid of it, or at least for now.
Jeez Louise.
And now your range of motion is so much better, your knee can go even further.
How much is
Let's do the same thing on the other side there. Okay.
Yeah, it feels pretty good.
Okay, now I want you to give me a stretch for this side. I want you to put it up there, right there, and bring it across.
Oh, yeah.
And let me know where it feels like it's not. There we go. You went right to it. There we go. All right. So now let go with your hand. Keep your knee right there. Grab the Theracane.
Grab the Theracane.
Find the spot.
Find the spot. All right.
Good, right there. Now I'm going to use my hand as if it's the wall you're next to. Now push the handle of it towards the ceiling. But yep, push the handle of this towards the ceiling.
I'm doing it.
You're doing it. There we go. 3, 4. Now, I want you to bring it back up. Bring it back up. Now move the knee towards me. Ah, that's what we needed to do to get that to release. 3, 4, then relax. I'm just going to hold it there. You bring the knee towards it. And then back. We feel like we're still on it there?
Yeah.
Oh, yeah, we are. Okay, good. And then do it a couple more times until it starts to feel a little bit better. Oh, you're great. You're moving much further out than you did before. And then again. Good, all the way. Nice. Look at that. Okay. Now, you feel like you've got a little bit of relief in there?
Yeah.
Okay, now stretch it again. I'll go ahead and take this away from you. Go ahead and no, the other way. Yep.
This way.
That way. And notice that that spot isn't nearly as intense as it was before. Sometimes it goes away completely. Sometimes it's just a lot less. And then as you move deeper into your range of motion, your body will uncover other areas but at some point it won't uncover anything because there won't be anything there. And that's what I want you to just keep thinking about, because it is a closed system. There will be an end to this. Okay. All right, good. That was really well done. I think we got it on camera really well for you too. So yeah. Nope.
Where is she? Oh, there she is.
Right there. Okay. So now you have some other spots. Or do you want to go through some of this again? You've got it on video. I think this is what you really need to just have some kind of guide as you go through the day. Okay. So now you had something going on with your elbow, you said.
Oh, it's this elbow.
Okay.
It was, it's weird because, I've got all this stuff going on up here. But where the pain is in my elbow.
Okay. So that indicates that there is some tension in this joint from the muscles below and above. Now we already did a little work on your tricep. Any sharpness through there? A little bit. This comes down and attaches right here. There we go. Now, what I want you to do is I want you to straighten your arm as hard as you can. There we go. Now turn towards, the thumb up. Yeah, turn all the way. There we go, right in there. Good. And relax. Now, I want to address this one here, and that's not going to be as important. So I want you to turn it out like this. And now as I press straight down into the table with you. There we go. Is that it? There it is right there. 3, 4, and then relax. 2, 3, 4. And again, we're pushing right down into it. Good. I'm feeling it start to wake up a little bit. Relax. 3, 4. Do it again.
Can I do this with the Theracane?
Yes. What you can do is you can take the Theracane.
Because I don't think I can do it with my finger.
No, what you're going to want to do is maybe put it down on the floor or something, and just press down into it like that, and press down.
Yeah,
okay.
Yeah.
Or you can actually take it with your other hand, bring it around to the other side there, hold it, and then straighten out and press down.
Okay.
There it is. Right
So I
there.
don't even have to be laying down, I can be sitting up to do that.
Yeah. You'll have to pull a little bit harder, okay, but that's not, again, you can, anything that you have to do, you can be more creative about how you do it so it doesn't stress out other parts of your body. And that's one of the reasons to use tools like this, because you don't have to press so hard with your thumb. This will do it for you with just a little bit of pressure, and it'll get even deeper than your thumb will. Okay? All right. So let's see. Let's do this. Since you had a little pain in this area here, let's find if there's more to this spot. There it is, right in there.
Yeah.
Okay. All right. So on this one, I want you to again straighten your arm out. Let's bring it over here. Okay, turn it in like this. There we go. Now straighten hard and press straight down into my pressure. And relax. Is this it right here? Okay. Go ahead straight. There it is right there. Good. 3, 4, and relax. Now, I'll bet actually if you try to bring your arm towards your side, that would actually increase it also. That's, okay. Listen, I didn't miss my calling. I should have been a torturer with the government, but
You use your torture things for good.
Yeah, I'm going to
instead
do
of evil.
exactly. There we go. Now press into it. There we go. Bring it towards your side. Ah, very good. 3, 4, and relax. Again, straighten and press right into it. There we go. Press down. There it is, right there. Good job. You felt the difference there, didn't you? Yep. 3, 4, and relax. 3, 4, and again, that was great. Right into it. How's that feeling now?
A little better.
A little better. Okay, this, and then relax. It feels like it's moving better. And then one more time. Ah, very good. And then down. There we go. Now, let's put some what? All right.
So did I hear you say that maybe perhaps part of the reason that she's in a lot of pain right now is because maybe just went a little too far?
Yeah,
Yeah,
very
okay.
possible. Or again, she's also working so many areas of her body than just isolating some of these movements. And that's something she'll have to learn over time, because right now she's been in so much pain, she has to do a whole bunch of of muscles just to do a little movement, because the one muscle that was supposed to do it can't do it. So now, oh, look at, you're doing exactly what I want you to do. Go ahead now, put this behind your head, way behind your head. There we go. Now bring it up towards your head. There we go. Feel the stretch in there now. There we go. Try to slide your hand down even further if you can. There we go, right down into it. And you're already stretching it. You know what you're doing right there is manually stretching the tissue, and that's perfect massage therapy technique right there. Feel how that stress, and you'll notice that it starts to become less
It's just
tight.
like rolfing.
I feel that there's a lot of elements in what I do in Rolfing. And again, Rolfing is all about getting ease of movement. And honestly, you can't have ease of movement if you still have trigger points in your body. So this kind of work is really effective in getting rid of those things that are limiting your range of motion and causing you pain, not necessarily in the area that it's locked down, but in the opposing muscle. See, I think a lot of what's happening here is because a lot of the muscle movement by your bicep is related to this set of muscles here that can't do it very well. And so you're going to get dysfunctional in the opposing muscle because you can't do this very well. So this can't do this very well. And so, okay, good. Now, again, let's go through this so that you understand what we're looking for. From here, the sternum, all the way along the left side, all the way underneath to your axilla here. This tissue is all dysfunctional. And when you find a spot that's sharp, right in there, let's see. Is it more here? I thought so. Okay, so from here, remember you're using the same technique for your with the shoulder as a fulcrum or as the beginning point of the arc. Okay, so now we're down here. So now look at this.
I'm trying to find it.
Well, here's my point. Start here to here, and whatever that line is, that's the way you push your arm. Ha, there we go. You just found it. 3, 4, and then relax. 3, 4, and then again, push through the heel of the hand. Feel the difference as it involves this set of muscles more. Okay, don't overdo it.
Don't make me hurt myself more than I want to.
Don't want to so much then. Because I know it's almost like this is a good pain, and if you do a lot of good pain, the old bad pain will go away. Well, there's a fine line. Like I said, this is a process. This is getting you started on your health journey, not getting you better next week. Okay, I mean, completely fixed next week. It's just not going to happen. But a lot of stuff's going to get so much better. It'll encourage you to keep doing this. It's one of the things that I love about this is I see my patients, their eyes start to light up and go, I think I can understand this. And they start doing it. They start feeling better. And it's just like, this is why.
Okay, now I want to stretch it.
Okay. No, you don't want to do something else first.
Oh, cream.
Great.
I'm wondering too if this is kind of one of those things like acupressure mat that when I've used it, it's basically is teaching my body that this particular pain is safe. And so I'm wondering if guessing that this might also be sort of one of those practices,
Yes.
especially if she pairs it with her chakra balancing. You know, that's another great clearing is this way of building trust with your body again.
Absolutely.
And really like loving it through the pain rather than get better, damn it.
And now she stretches it out. Going now, remember you went straight down, so you have to go straight up. Yep, there we go. And you feel that nice stretch in that area. Yeah, I'd actually like to learn a little bit more about chakra balancing. So that's one of those
Expert
things.
right here. She's already got a course like that. That's been done. She's given it many times. We're just trying. We want to get it on her channel and
Great.
stuff. So yeah, she's.
in a book and all of that stuff.
And we already have some recorded, so I can send you one just so you can get a sense for it.
That'd be great. Like I said, I intend not only to get the kind of payback from you by doing this myself, but I also figure that you're going to help me in a bunch of ways too.
Yeah.
This
That's
is
a
why we do
relational
that.
business.
Yes, exactly
It's
what
not
it's about.
transactional,
No.
cash based.
Oh gosh, but I think that isn't that everything's supposed to be, says
No,
Donald Trump?
we're fucking done with that.
I
No,
hope so.
we're living the new paradigm already, and we're just trying to model it and demonstrate it. And you guys are doing that right now with your generosity and are yapping about it as much as possible and posting about it. And
Well, like I said, that's what my goal has always been, is to ease everybody else's ability to be able to live their life, and I'm blessed to be able to
Be of
do what I'm doing
service.
here, to be of service, absolutely. So,
You are of service.
yeah, already.
okay, so I think you've got a really good set
I think I'm
beginning.
done. I'm
And I don't blame you,
done.
because I think you've worked really hard. You've done a lot of good work here. You're going to be sore tomorrow because it's been a while since we've done this, but the soreness shouldn't last as long because now these areas have been moved before, and they're not so likely to complain at you because they know you're changing their movement patterns, and I think they're going to like it.
Okay.
If she continues to be in quite a bit of pain though today, I mean, is there
Cream.
anything you suggest? Just more
The
cream.
cream is
Okay.
incredible, plus stretching that area.
Okay.
Because the reason she's in pain is the muscle is spasming.
Uh-huh.
Okay? So if you force it to stretch,
Mm-hmm.
it can't spasm.
Mm-hmm.
And that's why a nice bit of stretching there with some of the cream to help take the pain away.
Mm-hmm. Cool.
Good.
All right.
That's awesome.
Well, thank you so much, John. I'm so excited about this and your willingness and interest in this, because there's so many people who are like, oh, I'm afraid to be in camera, and it's like we gotta talk about stuff, and we can't bring every individual into the room with us,
Right.
and but this way we can. And this is what my business is a lot about. And and then this is
Again, this is one of the reasons why I continue to try to put myself out into somewhat uncomfortable situation. That was the first time I'd done any of that, and yet what it's created for me is some amazing relationships. And so,
you said, you're like, I think I was supposed to be here today, and that's usually what happens. If somebody's like, I don't understand what's going on here, you guys are sitting around and talking and cuddling and stuff, like what's happening, but most have the experience you did. You just follow your intuition, and then now you're bringing magic to Jeanette. And
like I said,
I'm in love with the
magic
DMSO
is-
too, honestly. Like I was having some pain, and I put some on, and
Well, I'd like you to come in sometime and I'll show you how to take care of it. Honestly, this stuff is so simple. You just have to practice it, and you're going to be amazed at how much it's going to improve. Like I said, I really appreciate that a lot.
Yeah.
So.